On this video, we are going to have your nursing care plan and nursing care management for patients diagnosed with liver cirrhosis. If you want to know more about that, stay tuned. Hi nurses, welcome back to my channel. If you're new here, my name is Neil Gaben. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals with their studies. If that is something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos 2 to 3 times in a week. Don't miss that ad. Subscribe now. You hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, you ready? Let's jump into the video. Hello nurses! Kung napapansin nyo ngayong mga sumunod na mga nakakaraang araw, ang puro ina-upload natin is about sa medical surgical nursing. Today, another medical surgical nursing topic nga ang ali ko sa inyo because we are going to discuss about your nursing care management for liver cirrhosis. Tatalakayin natin yung causes, classification, diagnostic tools, assessment, nursing intervention, nursing planning, all of that good stuff and more in one video. Now, in order for me to do that, I will need to switch back to my PC and I'll see you guys in a bit. Hi nurses! Welcome sa ating formal discussion ng yung hepatic cirrhosis, and this is your nursing care management study guide. Now, this is under the concept of your medical surgical nursing. Napaka-broad nga po ng topic na ating med-surg, and I decided to create this playlist or this part of my channel dedicated to all the Filipino nurses, not just for Filipino nurses, but to the nurses all over the world. Kaya all throughout the discussion, this discussion, I'm going to speak in English and I'm also gonna speak in Tagalog. Okay, para makater natin yung both audience. But kung hindi mo pa alam na marami na nga akong ginawang medical surgical nursing study material dito sa aking channel. Kung hindi mo pa napapanood yun, panoorin mo. Ililink ko yung actual description box, actual playlist ng, actual link ng playlist sa description box, or kapag nagpapaut yung icon button, panoorin mo siya kasama ng iba ko pang ginawang mga nursing educational contents. Now, without further ado, let's proceed. Ano-ano ba mga dapat mong asahan sa ating discussion for today? Now, I'm gonna share to you our objectives for today. We're gonna have a clinical description of your hepatic cirrhosis. We're gonna classify this condition. What are the causes of your hepatic cirrhosis? Clinical manifestations, assessment and diagnostics, medical management, surgical management, and of course, hindi mawawala ang iyong nursing management. Handa ka na? Let's proceed. Agenda natin today, ano nga ba ang description o paano nga ba ang definition ng iyong hepatic cirrhosis? Now, i-define natin to. The end stage of liver disease is called cirrhosis. Hepatic cirrhosis is a chronic hepatic disease characterized by diffuse destruction and fibrotic regeneration of hepatic cells. As necrotic tissue yields to fibrosis, this disease alters liver structure in normal vasculature, impairs blood and lymph flow, and ultimately causes hepatic insufficiency. The prognosis is better in non-cirrhotic forms of hepatic fibrosis, which can minimal hepatic dysfunction and don't destroy liver cells. Once again, these are your clinical definition of your hepatic cirrhosis. Now, let's classify this condition. Medyo mahaba-haba nga pala ito Humanda ka na. Get your chichirya and your tubig and your notes na mag-notes ka na. Now, these clinical types of cirrhosis reflect its diverse etiology. Ano to? Laennec's cirrhosis, which is the most common type. This occurs in 30% to 50% of cirrhotic patients, up to 90% of whom have a history of alcoholism. Yes, it is very much linked to alcoholism. Biliary cirrhosis. Now, this type of cirrhosis or classification results in injury or prolonged obstruction. Biliary cirrhosis, you are talking about obstruction. Post-necrotic cirrhosis. Post-necrotic cirrhosis stems from various types of hepatitis. This is very linked to your hepatitis A, B, and C. Pigment cirrhosis. Now, pigment cirrhosis may result from disorders such as hemochromatosis. Cardiac cirrhosis. Cardiac cirrhosis refers to cirrhosis caused by the right-sided heart failure. Idiopathic cirrhosis. Idiopathic cirrhosis has no known cause. Unknown etiology po ang ito, ang idiopathic cirrhosis. So once again, these are your classifications of your liver cirrhosis. Dito na tayo, ano nga ba ang sanhi ng iyong liver cirrhosis? Aaralin natin yan isa-isa. Now, the different types of cirrhosis have different causes. Excessive alcohol consumption. Too much alcohol intake is the most common cause of cirrhosis as liver damage is associated with chronic alcohol consumption. Bakit? Saan ba minametabolize ang iyong alcohol kapag uminom ka? Hindi ba sa liver? So, kapag nasobrahan ka, that could lead to liver cirrhosis in a long term. In a long run. Kapag tumanda ka na, doon mo siya makikita, doon siya magmamanifest. Ano pa? Injury. Injury or prolonged obstruction causes biliary cirrhosis. Hepatitis. The different types of hepatitis can cause post-necrotic cirrhosis. Now, other diseases nga po can also cause your liver cirrhosis. Ano-ano to? Yung tinatawag nating hemochromatosis. This can cause pigment cirrhosis as discussed in the classification. Ano pa? Right-sided heart failure. Now, cardiac cirrhosis is rare kind of cirrhosis. This is caused by right-sided heart failure. Once again, you guys, these are the causes of your what? Liver cirrhosis. Nakakasunod pa ba? O, ito na tayo. Clinical manifestations. Ano-ano nga ba mga signs and symptoms ng yung liver cirrhosis? Isa-isahin natin yan. Now, the clinical manifestations of different types of cirrhosis are similar regardless of the cause. So, iisa lang sila. Una, GI system. May apekto po siya sa ating GI tract. Early indicators usually involve gastrointestinal signs and symptoms such as anorexia, indigestion, nausea and vomiting, constipation, or diarrhea. Ano pa? Respiratory system. Respiratory system occurs late as a result of hepatic insufficiency and portal hypertension, such as pleural effusion and limited thoracic expansion due to abdominal ascites, interfering with efficient gas exchange leading to hypoxia or low level of oxygen in blood. Ano pa? Central nervous system. Signs of hepatic encephalopathy also occur as a late sign. Gusto kong tandaan mo, hepatic encephalopathy, late sign na po iyon. And these are lethargy, mental changes, slurred speech, asterixis o yung ating flapping tremors, ano pa, peripheral neuritis, paranoia, hallucinations, extreme obtundation, and ultimately comatose. Hematologic. The patient experiences bleeding tendencies and anemia. Endocrine. Yes, may effect din siya sa ating endocrine system and organs. The male patient experiences testicular atrophies. Lumiliit ang testes ng iyong male patient, while the female patient may have menstrual irregularities and gynecomastia and loss of chest and axillary hair. Sa skin, meron din. Alam mo naman to, di ba? Naninilaw. There is severe pruritus, extreme dryness, poor tissue turgor, abnormal pigmentation, spider angiomas, palmar erythema, and possibly jaundice. Kapag ang pasyente ay nagsa-start na mag-jaundice, huwag mong isipin na early sign yun. No, that's actually the late sign of your liver cirrhosis. Next, meron din tayong hepatic. Hepatic or cirrhosis causes jaundice, ascites, hepatomegaly, edema of the legs, hepatic encephalopathy, and hepatic renal syndrome. Once again, these are your clinical manifestations of your liver cirrhosis. Screenshot mo, girl, or kung masyado mabilis, you can pause from time to time. Okay, assessment and diagnostic findings. Paano mo nga ba ina-assess at paano mo nga ba dinadiagnose ang pasyenteng merong liver cirrhosis for you to confirm na meron nga siyang ganitong klaseng disorder? Ito na siya. Laboratory findings and imaging studies that are characteristics of cirrhosis include the following. Liver scan. Liver scan shows abnormal thickening and a liver mass. Ano pa? Liver biopsy. Now, with this diagnostic procedure, This is actually the definitive test for cirrhosis, as it detects destruction and fibrosis of the hepatic tissue. Confirmatory liver biopsy, liver imaging, computed tomography scan, ultrasound, and magnetic resonance imaging may confirm the diagnosis of cirrhosis through visualization of masses, kasi nga pwede rin siya maging cause ng biliary obstruction. Kaya titignan mo kung merong dyan, may mass or may tumor, abnormal growths, metastasis, and venous malformation. Ano pa? Cholecystography and cholangiography. These do visualize the gallbladder and biliary duct system. Splenoportal venography. Graphy, meaning visualization. Splenoportal venography visualizes the portal venous system. Okay, next you have your percutaneous transhepatic cholangiography. This test differentiates intrahepatic from extrahepatic obstruction jaundice and discloses hepatic pathology in the presence of gallstones. Complete blood count. So ano yung makikita mo sa CBC mo? Meron ka dyang decreased white blood cell count, hemoglobin level, and hematocrit, albumin, and or platelet count. Alright, tapos na tayo doon. Dito na tayo sa ating medical management. Under na yung medical management, tatalakayin natin yung mga pharmacological treatment na binibigay sa mga pasyenteng diagnosed with liver cirrhosis. Okay, treatment is designed to remove or alleviate the underlying cause of cirrhosis. Sa diet natin, the patient may benefit from high-calorie and medium to high-protein diet, as developing hepatic encephalopathy mandates restricted protein intake. Sodium restriction. Now, this is usually restricted to 2 grams per day. Fluid restriction. Fluids are restricted to 1 to 1.5 liters per day. Activity. Rest and moderate exercise is very essential. Paracentesis. Now, this may help alleviate ascites. Sengsten-Blakemore or Minnesota tube. The Sengsten-Blakemore or Minnesota tube may also help control hemorrhage by applying pressure on the bleeding site. Once again, these are your medical treatment. Okay, proceed na tayo sa ating pharmacological therapy. Now, drug therapy requires special caution because the cirrhotic liver cannot detoxify harmful agents effectively. Diba? Isa sa mga nag-metabolize ng mga medicine na tinitake ng natin o ng kahit nung alak na ininom natin is liver. So, ano-ano yung mga gamot na ibibigay natin? Octreotide. Now, if required, octreotide may be prescribed for esophageal varices. Diuretics could be given. Now, this can be given for edema. However, they require careful monitoring because fluid and electrolyte imbalance may precipitate hepatic encephalopathy. Lactulose. Encephalopathy is treated with lactulose. Antibiotics. Antibiotics are used to decrease intestinal bacteria and reduce ammonia production, one of the causes of encephalopathy. Okay, ang bilis lang, diba? Surgical treatment. Malapit na talaga to. Kumapit ka lang. O, galaw-galaw kayo. Eto na siya. So, paano nga ba ang surgical treatment ng iyong liver cirrhosis? Isa lang, transjugular intrahepatic portosystemic shunt TIPS procedure. Okay, ano to? Now, the TIPS procedure is used for the treatment of varices by upper endoscopy with banding to relieve portal hypertension. Once again, that is your TIPS. Transjugular intrahepatic portosystemic shunt. Ang mouthful, diba? O, yun na yun. O, nurses, ito na ang pinakahihintay mo, ang ating nursing management. Sa mga susunod na slides, tatalakayin natin yung nursing assessment and nursing intervention mo sa mga pasyenteng may liver cirrhosis. Now, the patient with liver cirrhosis needs close observation, first-class supportive care, and sound nutrition counseling. Eto na siya. In terms of nursing assessment, ano ba yung mga i-assess mo? Una na dyan ang bleeding. Check the patient's skin, gums, stools, and vomitus for any signs of bleeding. Fluid retention. To assess for fluid retention, nurses weigh the patient and measure abdominal girth at least once daily. Mentation. Assess the patient's level of consciousness often and observe closely for changes in behavior or personality. Once again, that is your nursing assessment. Okay, dito na tayo sa nursing intervention. Marami to. So, kumalma kayo. Dito tayo magfo-focus, okay? Ano ba? In terms of promoting rest, remember, we need to promote rest for patient with liver cirrhosis para bumaba ang metabolic demand. Position bed for proximal respiratory efficiency. Provide oxygen if needed. Initiate efforts to prevent respiratory, circulatory, and vascular disturbances. Encourage a patient to increase activity gradually and plan rest with activity and mild exercise. Once again, that is how are you going to promote rest. Next nursing intervention na tayo, improving nutritional status. Provide a nutritious high-protein diet supplemented by B complex, vitamins, and others, including A, C, and vitamin K. Encourage patient to eat, provide small frequent meals, consider patient preferences, and provide protein supplements if indicated. Provide nutrients by feeding tube or total PN parenteral nutrition if necessary lang naman. Provide patients who have fatty stools, steatorrhea, with water-soluble forms of fat-soluble vitamins A, D, and E, and give folic acid and iron to prevent anemia. Provide a low-protein diet temporarily if patient shows signs of impending or advancing coma. Restrict sodium if needed. Tinalakay natin kanina, di ba, yung restrictive sodium intake sa mga pasyente. Naalala mo pa yon? O, balikan mo yon mamaya. Okay, nursing intervention natin, providing skin care. Change patient's position frequently. Avoid using irritating soaps and adhesive tapes. Kasi nga, meron silang skin irritability, may erythema sa skin. Tinalakay natin yung kanina sa clinical manifestations. Kung nakalimutan mo, balikan mo lang, dear. Ano pa? Provide lotion to soothe irritated skin. Take measures to prevent patient from scratching the skin. Importante rin dito na pwede mo i-advise sa pasyente mo, keep the nails always short, clean and short, okay? Ano pa? Reducing risk of injury. Paano mo to gagawin, nurse? Ito na, use a padded side rails if patient becomes agitated or restless para maano yung self-injury, ma-avoid natin yung self-injury. Ano pa? Orient to time, place, and procedures to minimize agitation. Kasi di ba meron tayong sa mga assessment mo yung mentation. Ito yon. Instruct patient to ask for assistance to get out of bed. Carefully evaluate any injury because of the possibility of internal bleeding. Provide safety measures to prevent injury or cuts. So, ano yung mga pwede mong i-advise sa pasyente mo? Pwedeng gumamit ng electrical razor instead dun sa manual or soft toothbrush para maiwasan yung gum bleeding. Apply pressure to venipuncture sites to minimize bleeding. Eto na tayo. Monitoring and managing complications. How are you gonna perform this? Una, monitor for bleeding and hemorrhage. Pangalawa, monitor the patient's mental status closely and report changes so that treatment of encephalopathy can be initiated promptly. Kapag nag-manifest ng patients mo ng signs of encephalopathy, you need to report that to the doctor so that you can manage that right away. Carefully monitor serum electrolyte levels and correct if abnormal. Administer oxygen if oxygen desaturation occurs. Monitor for fever or abdominal pain, which may signal the onset of bacterial peritonitis or other infection. Assess cardiovascular and respiratory status. Administer diuretics, implement fluid restrictions, and enhance patient positioning if needed. Monitor intake and output daily, weight changes, change in abdominal girth, and edema formation. Ano pa? Monitor for nocturia and later for oliguria because these states indicate increasing severity of liver dysfunction. Once again, these are your nursing interventions and how are you going to monitor and manage complications. Eto na, malapit na talaga to. Home management mo sa pasyenteng may liver cirrhosis. Siyempre, meron ka dyan mga health teachings mo upon discharging the patient. Hindi naman siya pa forever na nasa hospital, hindi ba? So, prepare for discharge by providing dietary instructions including exclusion of alcohol. That is very important. Refer to Alcoholics Anonymous, AA, mga AA meeting natin, psychiatric care, counseling, and spiritual advisor if indicated. Continue sodium restrictions, stress avoidance of raw shellfish. Provide written instructions, teaching, support, and reinforcement to patient and family. Bakit kailangan written? Kasi hindi mo naman may expect na ma-absorb lahat yan ng pasyente mo. So, mahalaga na meron silang parang notes. Kung kaya mo naman at talagang you wanna go for extra mile, you're gonna give that to your patient upon discharge para meron siyang notes na pwede niyang mabasa. At masasuggest ko para mas maging effective ang health teachings mo, you might wanna plan or write that instructions with the patient and the family para collaborative care na rin. Encourage rest and probably a change in lifestyle, adequate well-balanced diet, and elimination of alcohol. Di mo napapansin, puro tayo alcohol dito. Instruct family about symptoms of impending encephalopathy and possibility of bleeding tendencies and infection. Offer support and encouragement to the patient and provide positive feedback when the patient experiences successes. Refer patient to home care nurse and assist in transition from hospital to home. Nurses, natapos na ang ating discussion. That is a wrap. Okay. Maraming salamat po sa pakikinig at panonood ng video presentation na to. Sana nga ay may natutunan ka. Kung malinaw sa'yo, kung malabo sa'yo, pwede mong balik-balikan itong video na to hanggang sa magets mo. Hindi masama yun, promise. Now, please like, share, and subscribe to my channel if you want to see more contents like this. Let me know if you have other nursing topics that you want me to create for you. Comment it down below. Abangan nyo nga po yung mga next video natin regarding sa nursing kasi i-upload natin sila sa mga susunod na araw. Now, help me out. Help me spread the news about my channel. Excuse me, pamali. Medyo mahaba nga itong discussion na to. Pero, tulungan mo ako ipamalitan mo na ang pinakabago, pinaka-fresh, pinaka-libreng nursing review center sa balat ng YouTube. And I'll see you again next time, nurses. You have a good one. Thank you so much, you guys, for watching. I hope you learned something. Help me grow my channel. You're already here. You might as well subscribe. #Team Cool Talk. Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, don't forget to check out the other playlists I create a few. I'll be putting the links on the description box or simply click the second button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Neil Galve except for my TikTok account, which is Neil Galve Official. I'll see you again.